Good afternoon and welcome to the third annual State of the Plan. For those of you who don't know me, my name is Megan Ferraro, and I serve as Executive Director of the ZAC Foundation and Chair of the U.S. National Water Safety Action Plan Steering Committee. The plan, published in 2023, is a national roadmap for collective action to reduce drowning. It provides a framework and tools to support the development and implementation of data and evidence-informed water safety action plans in communities, counties, and states across the United States. Since the plan was published, we are pleased to see plans published in states like California, Hawaii, and New Jersey, and plan development well underway and almost complete in states like New York, Arizona, Texas, Florida, and others. In the last year, we also saw communities come together who were experiencing spikes in drowning to publish their own county level plans, like in Suffolk County, New York, and in Central Florida. We're pleased to share that we have officially formalized the plan. We have 501c3 status with the federal government and are building a board and adding new members to our steering committee. If you're interested in participating in either of these groups, please reach out to me for more information. Today, we'll hear from Tina Dessart, the plan's interim director on key metrics, a technology update, and content improvements. We'll also hear from Tizzy Bennett from the Life Jacket Working Group, Dr. Bill Ramos from the Data Surveillance Working Group, and Morag MacKay, who will share more about the plan's research agenda. We're also pleased to welcome Dr. Tessa Clemens from the CDC Foundation, who will share key insights on her work. Last, we'll share with you what you can expect to hear from the plan in 2026 and answer any questions you might have. But before I turn it over to my colleague, Tina Dessart, I wanted to share with you that just before the holidays, the World Health Organization released a global strategy for drowning prevention. You can find a link to that in the chat or maybe in the Q&A section. That strategy noted a 38% decline globally in drowning rates since 2000. And the goal that is set out for this strategy is to reduce drownings by 35% by 2035. The US is looking forward to helping achieve this goal. And we're happy as we go through the meeting here today to monitor the Q&A and answer questions as we get toward the end. And with that, I will turn it over to my colleague, Tina Dessart. Tina?
Thank you, Megan. So welcome everyone today. We will make sure, if we can't get the links to you during the conversation today, we will make sure and follow up with a list of all of the links that we're talking about. I know that, it's one of those things that happens with technology sometimes. So we'll make sure that we have access to that for everyone. I wanted to start briefly with kind of an introduction into where the plan has been in 2025 so that we can look forward as we close out today towards what we're going to be doing in 2026. So I'm going to share my screen. Maybe. There we go. So I want to talk first about some communications highlights. Basically, in general terms, we've started with in 2025 some brand consistency so that we could ensure that we had the similar branding across all of our communications networks and platforms, including social media, newsletters, the website, you name it. So that's kind of where things started in 2025. From there, we look at website engagement, and we've seen consistent growth over the course of the year, both in user engagement, unique user engagement, and the amount of time folks are spending on the website as well. From a newsletter standpoint, we've kept up with a quarterly newsletter cadence, which seems to be working for folks. We have a really high open rate compared to industry standards, so we're really pleased with that. And then as far as our click-through rate, it seems also that the information that we're sharing is both informative, but also information that people are interested in and want to connect with. So that's been a really positive highlight for us. From an email situation standpoint, we've also seen the newsletter distribution network itself grow. in leaps and bounds, honestly, over the course of the year, which is really nice to see, which tells us that not only are you reading the information that we're sharing, but you're also sharing it with your colleagues. When we look at social media, and we have, for those who aren't aware, we have social media platforms on Instagram, Facebook, LinkedIn, and now we also have a YouTube account that was established in 2025. So all 4 of those platforms are highly engaged currently, and we continue to see rapid growth and expansion there as well. One of the things, or a couple of the things that we did over the course of the year with social media in particular, is try to look at what should the cadence be of our social media posts, what kind of content should we be generating, and certainly that's always something that we're going to continue to update and monitor over the course of time. But one of the things that really stood out was the engagement with regards to our Share Your Story campaign and the Go Blue for World Drowning Prevention Day. With that, with those 2 campaigns, we generated over 100 pieces of content that we were able to share with the World Health Organization. And I'll shift over to this just as an example. These were some of the pieces of content that were shared with us, which in turn allowed the World Health Organization to include the US in their recap, which was really nice to see. When we look at overall impact from an engagement perspective, as those of you who have been on the website and seen the resource page know, we have an engagement opportunities section. So when we talk about engagement, we're looking at webinars, office hours, in-person events where the plan or our steering committee has been present in order to engage with people, kind of boots on the ground, if you will. We hosted a total of 6 different webinars this year, including the January State of the Plan, some reflection to action webinars, which included some pre-recorded sessions along with a live session that we did in conjunction with NDPA. We had a number of views in those recorded sessions as well. So for events where perhaps we recorded a live session and then posted it on YouTube, we had a great follow-up representation from the community, which is really nice to see. From an office hours perspective, as you're aware, we host office hours on a monthly basis, and we alternate between state and community level engagement opportunities or conversations, if you will. And in addition to kind of that college-based office hours kind of scenario, we've also had times where we brought in guest speakers and seen really great engagement from that opportunity. And those typically have been recorded and then hosted on the YouTube platform as well. So we've seen great engagement both in person with those and then in the recording sessions. From an in-person events standpoint, we were at 2 conferences this year, what is now the International Aquatics and Water Safety Conference, or AOAP and NDPA, and then we participated also with a booth at the Safe Kids PrevCon back in the fall. And so we will be looking to increase those going forward, but we had some great participation at both of those events, in addition to a number of other events that individual steering committee members perhaps participated in and spoke at. When we look at actual engagement, as Megan referred to earlier, and we going forward with the action dashboard, which we'll touch on in a second, we looked at 3 state strategies that were published this year. Those of you are probably already aware, obviously, Hawaii and New Jersey were published. And then as we published this particular page on the website, we were notified that New Hampshire also had published a strategy. So we have 3 state strategies that we can claim that were published in 2025. We have one state, obviously from New York, that commissioned their report, or their state commission report was published, in 2025 as well. And so in total, if we look at the states that have published something over the course of the last year, we're looking at 4. We have 2 additional states that are looking to publish coming this year in 2026. We know that Florida is right there and hoping to see that information come forward into fruition in the next month or so. We do have 9 county or regional level strategies that we're aware of currently. And you'll see these are noted by these blue circles that indicate kind of that county level or wider distribution sense. And then 6 community level strategies that we're aware of. And those are noted here by these little yellow pins. just so that you're aware, these may not be kind of the traditional, what we've seen with a California or Hawaii or a New Jersey strategy. Some of them might be internally based or more strategic alignment and direction for a coalition within that area. But we're not necessarily putting definitions around what a strategy should look like for an individual community, because obviously it's going to differ from one place to the next and what their abilities, capabilities, funding, and requirements are going to be for the folks in their community. So that's where we are currently from the standpoint of the strategies. So now I'm going to shift into more of a technical aspect on the website and the plan itself. So in 2025, I think the first thing that we did was launch the new website, so watersafetyplan.us, which most of you obviously are already familiar with. I'm noting from some older slides even where some of the updates have occurred, but also I realized that there might be folks on this call who haven't participated in previous webinars, who aren't quite familiar with the website. So I wanted to make sure that I touched on kind of the majority of the site as we go through this pretty quickly here. So some of the initial updates on the primary landing page, or the new content that you'll see, are we moved the donate button, although it does still exist kind of in this header bar. We did move one up to the top. And then the action dashboard certainly is something that's new from a name perspective. There was a previous tab there, and I'll show that here in a second. So when we look at the About the Plan section, right? So if we come across the top headers here with About the Plan, one of the things that we haven't called out previously specifically is the glossary of terms. So for those who have looked at the hard copy document of the U.S. National Water Safety Action Plan, in the back of that document, there is a list of a glossary, and that's what's here. And so if you click on that under About the Plan, then you'll see that listing is defined here in alphabetical order, and so that you can find not only what the document has, but it's listed here as well. When we look at tools for action, we did expand this content over the course of the year. I think the blocks probably were here earlier on in the year, but we added the national implications and the resource page over the course of the time. And then when we look at guidance to support local action planning, I think the thing that we really want to call out on this page for those who might not be quite as familiar with the plan and the website itself is the information that's available and the resources and the tools that are available on this page. So this section, and this is a split screen here, but it's one long page if you look at the website. This section here really is where you can dig into the details of what we would call a workbook, and sections that you can pull out and really work through as you're starting to develop your plans and your strategies. When we flip over to the key areas of action, and I'm just going across the tabs as we go here, you can see that we've identified the 6 key areas that were outlined in the plan itself, and each one of these will take you to the action recommendations under those particular topics. Then we look at the action recommendations database. And one of the things that I'll call out here that we've done already in late 2025 that was part of our 2026 build is underneath these filters, there have previously been 2 links available, one for the key areas of action and the second for the spectrum of prevention, which just take you to another page that kind of define what that information is for you and expand the content a little bit. We've also added links for the implementation level, your state, county, community, national, and then the evidence levels. So this was something that came up as we launched the recommendations database, and folks had questions on how did we determine whether it was a high level of evidence or a low level of evidence, and that information is now provided on the website if you click on that link. If you do click on that link, you'll see it here. It brings you to the spectrum of prevention page that previously existed. We've just added headers at the top that link you down to the bottom, so you can find the implementation level definitions and the evidence level descriptions. On the action recommendations database, for those who are not familiar, all of these filters have drop downs where you can make selections on the content that you're really interested in. So if you're only interested in details for rescue and CPR, you're interested in how that might apply to educating providers at the community level, and only things that maybe have a high level of evidence, then you can certainly select those filters and it will drop down into what here we might see as 9 different recommendations as opposed to the full list of 98. So feel free to play with that as much as you want. When you click into, I'll go back a second. If you click into, let's say this is barriers and entrapment, number 2, require inspections for pool safety compliance on property transfer or remodel. If I were to click on this title, then it will open up to more information on that specific recommendation. And I know this is difficult to see, it's small, but I just wanted to give you an example of the amount of information that's available to you for the majority of the recommendations that are in there. Not all of them certainly have the depth of this one in particular, but you can see that there's a rationale behind it, anticipated impact, evidence sources, high-risk populations that would be addressed, evaluation metrics, implementation challenges to implementation if there are things that need to be considered, potential facilitators, and then if there were any gap recommendations noted by the working group that facilitated this particular recommendation, then that information would be provided here as well. So there's a ton of content to explore to help support the recommendations at each level. So now if we look at the national implications, similar structure to the way that we've laid out the action recommendations, but not quite as detailed, if you will. So these national implications were developed really, if we look at, the action recommendations were more specific to the county, community, state level. National implications are there to support that work and kind of squeeze it from the top, if you will. And so really looking at identifying how we can bring together groups from a number of different agencies or fields to make this work happen. So if we click into the national implications themselves, you can see this one in particular. There's an opportunity for progress notes if there's a working group established for this particular implication. And then any of the action recommendations that address this or are tied to this national implication will be listed here, so you can click into them further. They also show, each one of the national implications also shows whether it's active, which means there's an actual working group taking part in facilitating the work. If it's in a finalization mode, which some of them are currently, or if there's work that's been done that's completed. And so we'll be able to update these as we go. And as we build more working groups, you'll be able to see and follow that work trajectory. On top of that, at the bottom of the page for each of the national implications, there's also this form that provides you an opportunity to tell us if you're interested in whether it's joining an existing working group, interested in the content that you might be willing to participate in a working group if it comes to fruition in the future, or if there's a funding opportunity that you might want to be able to support one of the working groups or the national implication itself. So that's what this form is about, is really being able to share your interest at whatever level with us so that we know that there is someone that's interested or an organization that's interested in supporting the work. And then one of the final tabs that we added was the resource tab. And certainly there's a lot of information on this page now. And so we'll be looking over the course of time to probably streamline some things a little bit better. But there is a lot of new content here. And so we've streamlined the engagement opportunities to the top of the page. And you can see that we've added some kind of smaller headers across the top to take you directly to the section that you might be interested in. So if you come to the resource page and you want to know what the most recent recordings are, you simply need to click on this link and it'll drop you down into the page. So you don't have to scroll all the way down through. But any engagement opportunity, whether it's a webinar, an office hour, if there's any other special interest group, or educational opportunity, those will all be listed here at the top of the page for you. We have streamlined, again, this was work that we had planned for 2026 that was done, thankfully, in 2025 at the end of the year. So we've gone ahead and streamlined the recordings that we have available through our YouTube account currently, just to make it easier to find information. It was starting to get a little bit broad and stretched out. And so we've condensed it a bit. So these top four, this big one will be the most recent video or recording that's been posted, with the subsequent 3 here. And then we've broken things into folders, so you can see the Reflection to Action webinar series, which is fairly specific to that Reflection to Action phase. Office hours, any recordings that we might have from those where we had guest speakers or specific topics that we wanted to address. And then any of the State of the Plan webinars or things that relate to the State of the Plan will be listed in this folder. So they've kind of been bulked into folders now to make it a little bit easier to find content. As we continue to scroll down the page, you'll still see the case studies and toolkits. As the plans start rolling out, if you will, you'll see we've added California, Hawaii, New Jersey to the list of case studies here. Now that we have the action dashboard, we might start switching some things around a little bit, but that's still to be determined. So for now, you can still find all of the case studies that were listed in the plan itself are listed here through these links. Toolkits are available on this page as well. So currently the toolkits that are available have to do with World Drowning Prevention Day and how you participate, but certainly additional toolkits will be made available in this space also as we move forward. And then finally at the bottom of this page, we've set up some space currently for research and related articles. We started receiving some information over the course of the year, and it was kind of like, well, we wanted to share it, but we weren't quite sure where to put it. And so this made the most sense to place it under resources so that you had access to that information. Additionally, any data resources and funding opportunities that we are aware of or that come to us that might be beneficial to you all, we've added them to the bottom of this page as well. And then we added the action dashboard in the fall. So we're super excited about this. This used to be where it's circled here, it used to be the report actions tab, which is why I say it's not necessarily a new tab, it's just a new name. But the action dashboard is where you're gonna find the map. And so when we talk about the map, right, this is the action dashboard map. You can find a tutorial at the top that will help guide you through the process of how to utilize the map and how to engage with it in the most convenient way. But really what it is if you click on anything, it's going to take you to additional information. There are direct links to content whether it's a state, county, or community has provided, whether it's their Instagram accounts or the direct link to their strategy or direct link to their website, list of their contact folks so that you can reach out to them directly and allow you to network without necessarily having to come through myself or the steering committee in order to gain access to that information. So we're hoping that you'll utilize this map, not only to see kind of where we are from a status perspective and how things are growing and evolving, but also from a networking perspective so that you can engage with folks across the US. We put a little bit of a key in here. I kind of went through it briefly before. When we look at the states, they're color coded so you can see what's published, what's in development, what might be emerging or someone has expressed some interest. And then our regional has kind of these bullets, and then the local and community level plans are the yellow pins. So feel free to play with that as much or as little as you like. It's quite the dynamic resource. Also on that page underneath the map is we go back to that report actions, right? So this you can see here at the top, this was the previous tab, the report actions. If you have content that you would like to see shared on the map, so let's say you're part of a coalition or you're part of a strategy that isn't yet listed, then there's a form underneath this for you to complete, and you can share all of that information and content with us so that we can get that up on the map for you. And then last but not least, the basics of a website, right? With the action recommendations being the primary purpose initially for the website. We wanted to make sure that those were front and center. And so that action recommendation button can be found not only at the top of the pages, but also at the very bottom in the footer. Anyone who's interested in the newsletter that hasn't signed up for the newsletter yet, those come out quarterly, as I mentioned. The newsletter sign up sits in the footer. To reach us or contact us, there's a form. You can just click on the contact us button here. And then certainly, especially now that we're a nonprofit, the donate button is available for you as well. And then the 3 social media platforms, they're linked at the bottom of the page also. So that's what I have to share as far as updates. I am going to stop sharing my screen. And then if anyone has any questions, let's see if there's anything in the chat. So there is a question in the chat about if you have a plan, you can send it, fill out that form on the action dashboard page, and we'll be able to utilize that content and go ahead and populate it onto the map right away. In addition to that, we'll make sure that you're included in communications that have to do with strategy development and status updates, things along those lines. And if there's anything specific for coalitions or groups that are developing strategies and in kind of that stage that you might be in, then we'll be sure to reach out to you and provide that content to you as well. So you can just fill out that form on the action dashboard page. That would be great. Any other questions? All right. Well, with that, then I am going to really briefly kind of go through. We talked briefly about working groups with the national implications. We established 4 working groups early on in 2025. Water Competency Working Group, Life Jacket Working Group, Model Legislation Working Group, Research Agenda Working Group, and Water Competency. Those were the 4 initial working groups that were established. They each had an objective, and I'll touch on them really high level because I know we have Tizzy and Dr. Bill Ramos here to share their working group status updates. The Water Competency Working Group was tasked with kind of developing what those water competency skills could or should look like for a child at different ages and in different locations and environments. And so they've been working through that and looking at it from a parental education perspective and trying to develop kind of an infographic, if you will, to share content with parents in the simplest manner as possible. I'm trying to avoid the rest of you. From the Life Jacket Working Group, we're talking about messaging and how do we message, and I'll let Tizzy take that in a second. Model Legislation Working Group is focused on how do we create a template for folks at the state, county, or community level to help adopt the ISPSC for residential pools. And so we're working on finalizing a legislative template, a toolkit around that, and then some additional content around that as well. And then from a research agenda perspective, then that's kind of self-explanatory to develop a research agenda, and Morag MacKay will share information on that as well. Data surveillance is a 5th working group that we kind of added as we went. So the research agenda as part of that broke into, much like we did with the action recommendations, into different topic areas, data surveillance being one of them. And out of that work continued beyond the development of the research agenda itself. And so that is kind of how that working group came to be. But I'll let the working group chairs for the rest of the groups take on from here. So Tizzy, let me find your slides really quickly. And then we'll turn it over to Tizzy.
Greetings from Seattle. It's really my honor to be able to share with you some updates from the Life Jacket Working Group. And next slide, Tina. As Tina said, the group has been focused on three different recommendations that pertain to messaging. The first two address recommendations for the use of life jackets, personal flotation devices or PFDs, rescue and other flotation devices while boating, swimming, participating in water-related open water recreational activities. And then the third recommendation relates to building national consensus around consistent terminology for those same terms, life jackets, personal flotation devices, and how they're used and in what context. Next slide. So the purpose of our work has been to develop, we've really honed in on developing a messaging document. And for use, initially, this is for water safety, drowning prevention, aquatic, healthcare, other providers, and then to be able to turn that into whether that be social media or education outreach to the general public. With the leadership of Adam Kaczmarchi, we defined our focus, key points, and developed an initial draft that all of the working group members had a chance to chime in on and debate. And on that note of debate, there were some areas where we really felt there were different perspectives and different thoughts and weren't quite sure how to proceed in terms of finalizing this initial set of messages. So this is where Tina then has picked up, and Kelly Toth and I volunteered to help talk to a few water safety experts and get their personal opinions and thoughts about these areas where we were looking for how to message. We redrafted our document based on this feedback and then looping back with the working group. And it's now back out for review with the working group, the people we talked with, as well as representatives from several other water safety and boating safety organizations. And then we're going to incorporate that feedback and then send it on to review by Water Safety USA. And our goal is to get it out there by spring of 2026. I do want to note we're now calling it a working document because we really want to facilitate and be really open and inviting of continued changes and dialogue. Next slide, please. The four areas that we honed in on for more discussion was the first was how do you define a PFD versus a life jacket and what's in a name? And we just want to say it's okay to use either personal flotation device or life jacket. Life jacket is much more commonly used term for the general public, and PFD is more often used in technical materials. And with either term, you will always want to be building in the context, the performance and turning ability, as well as it being one of many safety measures and layers of protection, and to focus on the behaviors that we're looking for. The next area is around guidance for approved flotation in natural bodies of water, especially lakes and rivers, guidance for approved flotation use in pools, and then guidance for approved flotation in boats for very young children or children under a specified minimum weight. And next slide, please. This last area is another recommendation I just wanted to touch on, especially with Kelly not being able to join us today. This is a recommendation to integrate education that meets national minimum life jacket education standards into K-12 programming. Well, first you need a standard in order to integrate that education. And kudos to NASBLA, the National Association of Boating Law Administrators. They picked up on this recommendation. They formed a group to then develop a K-12 PFD education standard. They've gotten it ANSI approved, and it is meant to be used by curriculum developers for course providers. Stay tuned, it'll come out in 2026. And with that last slide, I welcome your questions and feedback, and thank you so much for your time.
Looking to see if there's any questions for Tizzy.
Thank you, Tina. And feel free to contact me afterwards. I'd be more than happy to share any questions or comments you have with the rest of the Life Jacket Working Group.
So Tizzy, there is a question about, is there guidance or is there a plan to be guidance on how to approach communities where many public pools don't allow life jackets?
Yeah, that pulling together of policy versus recommendations, and that is a really great question. And one of the things the working group has been thinking about is where do we go from here? And I'm really going to bring that back to the group because I think that's such a good point around a sub piece around, particularly in aquatic settings, what to do when then we're talking about approved. And then there are also aids that are used as part of swimming in the context of swimming lessons. So that brings in a whole other layer of importance for helping people understand the use of life jackets. Thank you for that.
All right, thank you, Tizzy.
Thank
Dr.
you.
Ramos, data surveillance.
Great. Thanks for having me in on the call and following Tizzy's lead. Hello from Bloomington, Indiana, Indiana University, your current home of college football champions. So very excited to have that on the table with us. Talking about the Data and Surveillance Working Group. Short report today, but much work happening. As Tina mentioned, it was kind of a shift for us from our previous objective to our new objectives. So we took some time to brainstorm, come up with some priorities, and two or three that we're currently working on. One is around developing a media reporting guide and toolkit that can help the media as we still rely somewhat or in some places on information we get from the media for data to help them better collect in what we need. And then also a lot of that will be about how to report out, the correct terminology to use, and also in their storytelling or their story writing, how to include resources that are available to them. So that's one project in flux. The other is the idea, the next two are about using the action plan site as a place to coalesce or become a repository for information. So one is a repository around research articles related to data collection and things in our field. And then the other one is actually a repository around data collection systems that are available, and even potentially maybe we create some guidelines on how people can use them, because I know I encounter people that want to use certain databases but don't have the information on how to get what they want. And we think that could be very powerful. So again, as we make a call out to the community, if you have access to these types of things and they are open source, we would love to hear from you and be able to kind of coalesce those together. That way people can glean information from them, but we can also start seeing the larger scope of who's collecting what, and kind of heading towards this idea of what may a larger general data collection system look like. Two other thoughts. One, I want to thank Tessa, who will be talking here in a minute. She's now the co-chair for the committee, and we felt that was really powerful because of the work with the CDC Foundation to make sure we are in line and not recreating the wheel. And then I'll finish up with a special thanks to Tina, who just really is invaluable, keeping us organized, keeping us on task, and helping us record and document our projects. So thank you, Tina.
Thank you, Bill. Any questions for Bill while we have him on? So Bill, there's a question about HIPAA. I don't know if you can answer this or not, but as we attempt to collect important data, how do we look at navigating the HIPAA guidelines?
Yeah, maybe that's a statement we can address. So those on the call with the working group, make note. We did address that in the earlier work of the plan, and there are caveats. I see Morag shaking her head. There are caveats in HIPAA that allow for this type of thing to happen. So perhaps we can think on a formal statement. I can't answer it in the moment, but there are avenues available to navigate HIPAA to allow people to access and use the data.
Thank you so much, Bill. Appreciate your time today. Morag, before we get into the research agenda itself, can you share with us? We've had some conversations about kind of the CDC, what expectations we might have going forward with what the CDC might be able to provide, and from an analysis standpoint. Do you have information on that you could share with us?
Yeah, happy to share it. So, as many of you will know, early last year, the CDC was a number of programs were cut, and including the entire unintentional injury prevention group, which was the group that was working in the area of drowning prevention. There were also some cuts to their data systems. So they have two that they regularly put out on an annual basis, which many of you will know, Whiskers. And there's a fatality database and a non-fatal injury database there. The fatality database will continue, is our understanding right now, but the non-fatal injury database, the funding for that was cut. So as of right now, the last year that will be put up is 2024, and my understanding that it will be coming in the next few months. So unless things change, that is likely the last national non-fatal data we will have for some time, which again is why I think the work of the data surveillance group in terms of are there other ways for us to look at non-fatal drownings, and in particular at the national level, right, in terms of making the case for ongoing funding for this issue, will become important. So that's sort of a not so happy update. Fatality data will continue to be available, but non-fatal will not after the last year is uploaded, which is to happen in the next couple of months. So it's now my pleasure to talk about the Research Agenda Working Group. As the U.S. National Water Safety Action Plan was being developed, we identified multiple evidence gaps, or the working groups identified multiple evidence gaps, and put those forward as part of what they contributed to the plan. In addition, the NDPA and the American Academy of Pediatrics co-hosted a summit back in 2022 focused on child drowning prevention that again really looked at what were key questions or key evidence gaps that would help us to reduce drowning amongst children. We took the results of both of those processes and sort of thought about, look at all of these gaps. And definitely we acknowledge that there is a need for both foundational research, but also more rigorous evaluation of a lot of the current what we are calling best practices. There just is a lack of evaluation there. We also know that research funding opportunities to support drowning prevention have really been limited historically, and that if you look at other injury issues, there are relatively few researchers focused on drowning prevention. So we thought within the U.S. National Water Safety Action Plan that a research agenda could serve as an important advocacy tool to increase the focus on drowning prevention research for both decision makers, those that are making decisions as to how funding is allocated, funding sources themselves, whether that's NIH and their funding, or foundations that are looking for priority areas to fund, and also for the researchers themselves. So we started off with the formulation of this multidisciplinary, multi-sectoral working group to oversee the agenda development. We reviewed all of the evidence gaps and research questions that came out of those two processes that I mentioned earlier. And we looked at them in subgroups of that working group to eliminate duplicates, to put them in a similar format. And also we looked at developing a scoring rubric so that we could prioritize those questions, because we had 76 questions in the end. And we thought it was important to sort of try and indicate some level of priority. So we went through what a modified Delphi process, where the working group members did an initial anonymous scoring. They then got to see and review comments from each other, as well as some comments that we received from members of the Drowning Research Interest Group, which is another group I'll talk about in a minute. And then after that review, a second anonymous scoring occurred. And then we took final scores and utilized those to prioritize. The final priority-based scores were then put into a document that is now available on the website. And in addition, we are also working on a section of the website, very similar to what you see for national implications, where it sort of talks about what the priority areas for research are and is someone engaged in that area or not as we go forward. That is up on the website now. The document is available, but we haven't officially launched it because we're working on a couple of other tools, a one-pager that we can give to decision makers that then links them to the document, but that they get the key information they need, and then a slightly longer two-pager that is more for sharing out with anybody that's interested in drowning prevention research that wants to understand a little bit more about the research agenda. The document itself is pretty simple. It really talks about why we thought it was important to develop a research agenda. It then talks about the importance of drowning prevention and why drowning is an important public health issue. And then we just get into the research questions and evidence gaps in two sections. One, which lists the top 20 per the scoring that occurred, and the other that is a complete list. And the complete list is divided by those six areas that also are reflected in the overall U.S. National Water Safety Action Plan. I mentioned another group, the Drowning Research Interest Group. This was formed in partnership with SAVOR, the Society for the Advancement of Violence and Injury Research. A couple of years ago at one of their conferences, I was sort of taking note on how much drowning research was being presented or not being presented, actually was the case. And I really thought that would align really nicely with the work that we were doing with the U.S. National Water Safety Action Plan. So in conjunction with SAVOR, we formed a drowning prevention research interest group. So that's a partnership between the U.S. plan and SAVOR, and Safe Kids is providing secretariat for that drowning research interest group. They are meeting quarterly. It's a combination of hopefully discussion and presentation. And the next meeting is actually next week on January 28th from 1 to 2:30 p.m. And Tina will drop a link in the chat. And if you're interested, please either reach out to me directly or use that link to sign up for the meeting. We look forward to seeing those of you that are interested in research join us. Thank you.
Thank you, Morag. Since I'm not seeing a chat available, I've made a note to send that out to anyone who is registered. So any of the links that were, we kind of prepped a list of links that we were going to talk about today. And so I'll make sure that that list is shared with anyone who is registered. So you'll have access to those in the follow-up. In addition, I will just mention, if you received the last quarterly newsletter in December, we did, there was information on this meeting in that newsletter. And so you can, if you have that in your inbox somewhere saved, then that link is also readily available there as well. Thank you. Just checking to see if there were any specific questions for Morag. All right. So one of the things that I will say when it comes to the research agenda and as we look forward, then as we start to develop that kind of rollout plan, then we'll start communicating that with folks so that you can have direct access to that information as well. All right, so now I'm going to turn it over to Dr. Tessa Clemens, who's going to share an update for us on the CDC Foundation and the work that they are doing. Tessa?
Are you seeing my slide properly, Tina?
Yes.
Great, thank you. Good afternoon and good morning. My name is Tessa Clemens and I lead the drowning prevention work at CDC Foundation. So I'm going to just provide a bit of an update on the work that we're doing and how it relates to various key areas of the U.S. National Water Safety Action Plan, and how we're hoping to address or provide evidence that can help people address a number of the action recommendations. So the CDC Foundation has 4 key focus areas when it comes to drowning prevention. The first is around data, and what we're doing is collaborating with state health departments in a number of states to explore existing data sources and better describe drowning through those data. So we know that the national administrative data sources that we have access to are very limited when it comes to understanding detailed circumstances around why the person drowned, what activity they were engaged in at the time, and those pieces of information are really critical for prevention. So through this data strengthening work, we're hoping to collect more information to that end, being able to develop more specific and tailored prevention strategies. Another focus area of ours is around understanding disparities. So we know that there are really significant racial and ethnic disparities in drowning, with Black and Indigenous persons drowning at much higher rates than other racial and ethnic groups in the United States. And so we're conducting focus group discussions and other qualitative work to explore cultural, historical, structural, and systemic factors that might help to explain some of those disparities. We're also looking at drowning prevention policies, and specifically cataloging drowning prevention policies, including backyard pool or private pool fencing policies, life jacket policies, and swimming and water safety policies, as well as providing resources for decision makers. And our final area of focus is swim skills training. And we provide grants for community-based organizations to partner with schools or school boards to provide basic swimming and water safety skills training, particularly in communities where people are at increased risk of drowning and might not have as much access to these programs. So I'll talk about each of these areas in a little bit more detail. All of the projects are focusing in 11 states with high drowning burden. We initially had 10 states of focus, which are the ones shaded in a light blue color on the screen, and we've just expanded to Hawaii this year. And these states were selected as the sort of initial project states because they have particularly high drowning burden. But this is not necessarily that they're just sort of the top 11 states by rate of drowning. We looked at a number of different factors, including drowning disparities within the state, both the burden by rate and the number of drownings that occur in the state, and also wanted to ensure that there was some geographic balance with at least one state from every region. The project states comprise about 50% of the US drowning burden. And you can see, for example, Alaska is included. It has the highest overall rates of drowning of any state. Florida has the highest rates of child drowning, and so on. So these are some of the reasons for the initial focus on these states. In terms of the Strengthening Data Project, what we've done is embed CDC Foundation data analysts and epidemiologists in a number of the state health departments from those 11 states. And we've initially conducted a survey to assess existing sources of drowning data and current drowning prevention strategies in the state. And this activity really allowed both the embedded analysts and epidemiologists, as well as their state health department counterparts, to start having a lot more conversations around drowning, building drowning prevention partnerships, or reinvigorating them where they had become dormant just because of capacity issues and competing priorities, and start understanding what data could be accessed, and creating partnerships needed to access sources that were not readily available. Then we set to work analyzing those sources that we could most quickly get our hands on. So in all of the participating states, that included vital statistics, mortality data, hospitalization data, and emergency department records. And then in each state, there were additional sources of data that the analysts were able to access. In some cases, EMS data, law enforcement data, media databases, and others. And we continue to identify and analyze and bring together those different sources of data to get as complete a possible picture of drowning in the state. Looking at the state level has also allowed us to expand the inclusion criteria for what is considered or what is typically included as a drowning when you look at those in administrative data sources, usually using ICD codes. So we're able to look at drowning even if it was not listed as the underlying cause of death. Or if it was listed somewhere else on the hospitalization certificate, for example. And this has allowed us to identify more fatal drowning and more hospitalization from drowning than typically is presented when we use the traditional criteria when we're looking at national administrative sources. And so in the next phase of the project, we'll be validating that method and potentially issuing that as a recommendation around drowning surveillance and reporting. So that's one example of the type of things that we're able to look at through this project. But in each state, the state has drafted a drowning report. In some cases, that's the first ever drowning report for the state. So we're hopeful that that information will be really helpful to drowning prevention partners for their efforts. Those reports will be released early in 2026, so over the next few months. Through this project, we've also supported drowning prevention partnership building in the states, and we'll be doing extensive dissemination of the data that have been compiled and reported on. And now each of these analysts are working on identifying additional sources of drowning data with a focus on that circumstance information, as well as sources of exposure data. So looking at estimates of the number of pools in the state, or visitation records of really high-risk areas for drowning, to try to be able to better understand drowning risk and how to best tailor prevention strategies. With the information that we collect over the next year or so, we'll be creating an online drowning surveillance and reporting toolkit. This will have really practical tools for people who are looking to use similar data sources in their own state for how to do that. And this will be released in mid-2027. So this body of work sort of most clearly aligns with the key area of action around data and public health surveillance. And it addresses a number of national implications that are related to that area, such as providing guidance on use of syndromic surveillance for drowning, providing guidance on drowning surveillance in general, including creating annual drowning reports and so on. But it also provides data and evidence that can support recommendations from many of the other key areas of action. In terms of understanding disparities, with this body of work, we're exploring how systemic forces may influence Black and Indigenous persons' perceptions, beliefs, and practices around water. And the goal of this is to be able to develop drowning prevention recommendations that are strengths-based, culturally responsive, and situationally appropriate. So this is really cross-cutting across many of the key areas of focus for the plan, and in particular, the national implication around instructor education and training and cultural competency, and ensuring that swimming and water safety programs are culturally competent. A lot of the information that we're gathering and reporting from this project could be useful towards those action recommendations and national implications. So we have published our first report, which is called Exploring Factors Related to Drowning Risk Among Black and African American Persons in Select States. The QR code on the screen will lead you to that report if you're interested in further exploring some of the recommendations that came out of that body of work. And we're currently conducting similar focus group discussions with Indigenous peoples, and we'll be expanding to Hawaii to do similar work with Native Hawaiian persons, and look forward to sharing the recommendations from each of those pieces of work over the next year or two. In terms of describing policies, our initial focus has been on private pool fencing policies in the 10 initial states of focus, as well as life jacket policies. But we've actually started to expand. So we have reviewed life jacket policies in all 50 states, and we will be reviewing pool fencing policies in the remaining 40 states as well. And the sort of product from this body of work is an interactive online dashboard, which summarizes the characteristics of the policies and provides resources for decision makers. So This work is really most related to the key areas of action around barriers, as well as the key area of action around life jackets. And it provides evidence to support the development of the many advocacy toolkits that are described in a number of national implications associated with the plan. So for example, there's an action recommendation around requiring the use of four-sided isolation fencing with self-closing and self-latching gates around residential pools. So the interactive online dashboard that we are developing will show in each local jurisdiction whether four-sided fence is currently required by the current policy, as well as self-closing and self-latching gates, the height of the fence, etc. So it really allows people who are doing policy advocacy work or trying to understand where improvements need to be made, what the current status is of the policies locally. We also are creating resources to sort of support strengthening of policies and making sure decision makers are aware of their policy options. One such resource is looking at the sort of economic benefit of stronger policies. And we published a study around the unrealized economic potential of pool fencing and life jackets. The QR code will take you to that publication. With the infographic on the screen is sort of an excerpt of some of the results from that work. So as I mentioned, we'll be expanding so that our interactive map has all states highlighted, and you will be able to click and get the detail on the policies in all 50 states for both pool fencing and life jackets. And we'll also be adding swimming and water safety policies to that. The initial 10 states that are currently populated with pool fencing policies and the entire 50 states for life jacket policies will be available in the next couple months. We're also conducting a national survey to estimate the proportion of US households with a residential swimming pool and the barrier characteristics of those pools. So what type of fence they have, and a number of other questions that'll be helpful again for conducting more robust economic analyses to support policies, and again, providing evidence to those working on the many different national implications and action recommendations related to these various policies. And finally, we're exploring the potential use of GIS software to estimate number of pools, as well as the type of fencing around those pools in specific jurisdictions. The fourth area of focus at CDC Foundation is increasing access to swim skills training. So this most closely aligns with the key focus area of the plan around water safety, water competency, and swimming lessons. And some of the national implications, such as, again, instructor education and training in cultural competency, best practices, developing best practices for water safety programming, developing standards and recommendations, related to swim skills training programs are all things that we're hoping to provide helpful evidence to support. So the CDC Foundation has awarded 56 grants to community serving organizations to partner with schools to deliver basic swimming and water safety skills training. We have a focus on schools because there is evidence that this reduces barriers for students, particularly from communities at increased risk of drowning, can be a very cost-effective way of delivering the program and can have a lot of benefits beyond just the swim skills acquisition among the children. 25,000 children have been served to date through this program. And we've taken a pre-post skills assessment across 8 skills, which are listed on the slide there. And we did find a significant improvement across all of the skills from the participation in the program. But as I mentioned, also found a lot of impact to the students themselves, as well as families, other family members signing up for lessons, schools reporting better attendance on days with swimming lessons and easier classroom management, and communities reporting on the impacts of the program to the community. For example, in some cases, the start of this program allowed a pool that hadn't been being used to be used. It allowed more instructors to get trained so that swimming lessons could be offered to others in the community, and so on. So the key recommendation that we are addressing with this program overall is offering affordable water safety education and swimming lessons for populations at higher risk of drowning. But again, we hope that with capturing both the swim skills data and conducting and reporting quantitative analyses around that, as well as qualitatively capturing the impact to the communities, that we'll be able to provide that evidence that'll support some of the other related recommendations as well. I did just want to mention, in case anyone hasn't seen it yet, that we do have an open request for proposals for that swim skills training program right now. So this QR code should take you to that RFP. I would mention again that eligible applicants do have to be from one of those 11 current focus states, and they do have to work in partnership with a local school for the program. So that was as fast as I can do the update, but lots of areas of overlap, and we really enjoy working with the U.S. National Water Safety Action Plan, and particularly with the Data and Surveillance Working Group to ensure that we're aligned and supporting the important work of the plan as much as possible.
Thank you, Tessa. Any questions for Tessa before we move on? Give it a second. And Tessa, if you can share that RFP link with me in an email, then I can add that to the list to send to folks after the fact.
Sure, thank you.
Not seeing any new questions. All right. Thank you again, Tessa, for your work with the CDC Foundation and for your work with the Data Surveillance Working Group as well. It's a pleasure to have you participating in that working group.
Thank you.
So that's kind of where we are from 2025 to now. And so what we'd like to do really briefly is take a quick look at kind of what's coming in 2026, at least what we know as of right now, right? Things obviously are going to ebb and flow and change over the course of time, but we have some very specific items that we know that are going to change over the course of the coming months. And so we're excited to share those with you. Megan, do you want to start with working group information?
Sure. So lots of chatter in the Q&A section about how to get involved, how to join working groups, how to bring together both members of the field and those that may not be directly involved in water safety. For all of that information, certainly keep an eye on our newsletter, on our social media channels. But if you feel like you need to get in touch with us more urgently, feel free to email us at info@watersafetyplan.us. Those working groups are going to be reformed as we begin addressing new topics. So it's a great time to reach out and express your interest. You heard me talk at the beginning of our meeting today about forming a board to manage the new 501c3 for the U.S. National Water Safety Action Plan and expanding the steering committee for the U.S. National Water Safety Action Plan. We've been really fortunate to have a dedicated group of individuals leading the plan. And some are beginning to roll off, including the beloved Dr. Linda Kwan. And so we're looking to not only expand the steering committee, but also, make sure that we are adding the experts that we need to fulfill the path that the plan is taking as we move into this next phase of our work. So do feel free to reach out, but also keep an eye on our newsletter and our social media channels for more information. As Tina, of course, as you heard Tina mention earlier in the meeting, we do host monthly office hours. Each month we're focused on a different topic, whether it be plan development at the state level or at the community level. Those monthly meetings are a great chance to come and talk with myself, Tina, and others on the steering committee about how to begin the process of developing your plan, or if you have a plan, how to take it to that next stage, that implementation stage. What I find to be most effective in those meetings is actually when Tina and I are not talking, but it becomes more of a peer-to-peer conversation where we'll have experts in California supporting our friends in Texas or Arizona or Florida. And so it becomes a really nice way to meet new people, learn new things, but to hear from your peers directly about what is working well or what isn't working in many cases in your communities. Access to those dates and the information on joining those can be found at watersafetyplan.us. So if you haven't visited our website, that's another great place to get all the information you need to stay up to date. As we think about how to move the plan forward, we have not only these working groups and our office hours. You saw Tina talk earlier about the action dashboard. At one point, I put a link in the chat to really look at where to fill in that information. If you have a plan that you're beginning, or if you're starting a process, or if you have a plan that's published, we want to know about that information. We want to not only learn what's worked for you, but reflect the work that you're doing on the website so that you can get credit and so that others can go to you for help, as you heard me mention. We're also looking for support for the plan. There's lots of ways that we can reach new people, whether that's through attending conferences that you may be hosting or that may be in your community, participating in your webinars, or having you participate in ours. It's been really helpful to us to have folks who have plans published or plans in development joining us and speaking about their experience. We're also beginning to fundraise for the plan, trying to find ways to bring in that funding that we need to ensure that we're able to develop new toolkits, new resources, evolve the website and our materials. We'll be coming up on what we're referring to as our report card about halfway through the plan. So there are lots of resources and materials that we will be developing to reflect out the work that we're doing at the national level and that you all are doing at the community level. So if you're interested in funding the plan or supporting us, again, please feel free to reach out, info@watersafetyplan.us. You can also reach out to me directly. If you happen to be at the upcoming International Aquatics and Water Safety Conference in Colorado Springs in about a month, feel free to stop by our booth. We'll also be hosting sessions that you can attend. A couple of sessions throughout the conference. We would love to see you. We would love to meet you in person, hear from you directly, and have you participate in those sessions if you'll be in attendance. So please feel free to stop by, to seek out myself or Tina or any of the other members of the steering committee that will be in attendance. And we're really looking forward to meeting you. Tina, are there any questions in the chat that we haven't addressed yet?
There are a few, but before we go there, I want to share really quickly some of the technology updates that we're planning for 2026, just so that you know that they're coming. Some of them are quite exciting. One is from a technology standpoint, when we look at, we've already talked about the research agenda and getting that information out to you, but that will also come in the form of a database similar to the national implications and the action recommendations. So you'll be able to look through those, find more information. If you have interest, or if there's a researcher who has interest, or a funder who has interest in supporting any of those research questions or gaps, then that opportunity to share that information with us will be available on the website as well. We're going to expand the glossary. I showed you briefly where that glossary was found on the website earlier. That's going to see a bit of an expansion with additional definitions and terminology, where some of that terminology came from. We can link to those resources for you through that expanded glossary opportunity as well. And I think one of the bigger things that we've been looking at over the course of the last year since we launched the action recommendations is, how do we allow you the opportunity to export the information that's most pertinent to you? And so we're exploring how to make that happen so that you can go in, you can select the action recommendations that make the most sense for you, for your community, or as you're building your strategy. and be able to hopefully download those, print them, bring them to a meeting so that you're not looking through all 98 of them with a group around the table, but you can kind of fine tune the information that you want to share with others. So we're really excited about that coming to fruition over the course of the next, hopefully a couple of months. We'll see how long it takes. And then we know that we come up with a lot of new things, right? We've gone through all of them in the last hour and 15 minutes or so. And so as we continue to expand, one of the things that we're going to do is try and consolidate all of those news and updates items, if you will, into more of a blog format on the website. So we'll be adding or replacing one of the tabs in the header so that you can simply click on that and have direct access to anything that's new, shared information. If there are publications or things that folks share with us, educational opportunities or additional detailed content that we want to be able to push out to you, it'll be readily available at your fingertips without having to sift through all of the information that we're now housing on the resource page. So another exciting update that will be coming. And then finally, as we talk about, funding the plan, then being able to recognize those funders through a donor recognition opportunity on our website as well. So more of a minor adjustment to some of the pages right now, but certainly something that'll be important for the plan going forward and for those who support the plan as well. So. Let's see what we have for final questions and go from there. So the glossary page, for those who are looking for it, and I will look at it really quickly myself, is under About the Plan. So on the header tabs across the top, if you go to About the Plan, it's one of the subheaders there for glossary of terms. And it will remain in that location. It'll just get expanded as we go. Megan, anything else? Otherwise, we can stay on and answer questions. And
sure. Tina, I see a few questions related to federal funding for swimming pool facilities, questions related to federal legislation and standards. As the National Action Plan is a 501c3, we can't lobby, but we are aware of a lot of work happening at the national level in not only educating legislators on the importance of considering water safety education, funding water safety projects, like areas that are considered pool deserts, but also just reinstating the funding for things like the Virginia Graham Baker Pool and Spa Safety Act, which not only ensures that pools are built to code and that we have safe drain covers in place, but it provides funding for the CPSC's Pool Safely campaign. So there is legislation happening at the federal level and legislation in development. And so as much as we can work to educate our legislators around the importance of water safety and the sad and upsetting drowning rates that exist here in the US. We do know a lot of work is also happening at the state level. From state to state, legislation is being introduced. Even this week in Florida, there's a series of pieces of legislation that are being worked on in the Florida legislature. We know that's happening in states like New York and New Jersey and Texas and California. And so to the extent that you can engage with both not only your federal legislators, but the legislators representing that are in your state assembly or your state house, your state senators, reaching out to them, educating them about this issue, really have an understanding of what the drowning rates are like in your state or in your community, so that those legislators can understand how this public health crisis is affecting their constituents. I think that really is so helpful, along with testimonials from folks from your community, from your state that have been affected by drownings. To the extent that you can convene that group together and have some real substantive conversations with legislators, I think that can be a really helpful way to ensure that work continues and that it grows from where it is today.
So Megan, there is a question in here that I feel like it's important for us to address just from the standpoint of who the plan is for. There is a question asking about the US territories. And while they might not be listed on the map specifically, just because of the makeup of how the map is generated and the tools that we have available to utilize, that doesn't mean that the tools and the resources that are part of the plan can't be utilized and recognized for the territories as well. And so just want to be clear that anyone can use the tools and the resources that the plan has made available. And we certainly encourage and advocate for the use of them. And then just to share with us the information that you can, whether or not we can figure out, we can certainly try and figure out how to add territories to the map if we need to. That will be part of the technology build out for sure, but not something that we're against. It's simply the way that the map was delivered to us as it exists.
Absolutely. And happy to help support the territories that are interested in doing this type of work. We would really much welcome any conversation, any opportunity for discussion, any way that we can be supportive. Please do reach out to us at info@watersafetyplan.us, and we'd be happy to schedule a call to discuss. I see, Tanisha, you have a comment in here around partnerships in the works with groups like Mothers Against Drunk Driving or NHTSA. What a great question. We often marvel at those two entities and how successful they have been at turning public health crises into really developing effective solutions to address them. We don't have any direct partnerships with those organizations currently, but I think we would very much like to. And so maybe that's a goal for us for 2026, that we can explore really borrowing against their successes and applying those strategies to this issue.
On the glossary of terms, there's another question on the glossary. Those are simply the terms that are currently listed are those that were found within the action recommendations as the plan was being developed, with the need to define what those terms meant for that specific purpose. As we look to expand it, we're going beyond what's in the plan specifically. And so you'll see that expansion as we move forward.
Judith, I see your commentary around ice safety is certainly something that we are certainly talking about. I know in my role at the ZAC Foundation, I've done quite a few interviews over the last month around winter water safety, ice safety. And so no direct kind of recommendations around ice safety in the plan. Correct me if I'm wrong, Tina. But certainly something we can continue to look at and point to other organizations that are doing good work in this space.
Megan, there's a question about partnerships in the works with groups like MAD or NHTSA.
Yes, I think a few minutes ago I talked through the fact that while we don't have any current partnerships in place with those organizations, they are organizations we have looked at, and we've looked at and studied how they have, really taken what have been public health crises and worked to drive those rates down. And we use those as examples as we were formulating the plan. I think a goal for us in 2026 will be to develop partnerships with those organizations and others. So certainly something we'll continue to work toward. And Dr. Simonian always reminding us to look toward AI to help us in developing new strategies and new tools. And Dr. Simonian, you're such a great example to how that can be done effectively. Thank you. Any other questions or comments before we adjourn today? I want to just take a minute while I'm waiting for those questions to come in to thank all of our panelists for participating. Really appreciate your time today. And all of you who attended and asked us really smart questions and helped us think about the strategy differently. If you would, please continue attending those monthly office hours, these webinars that we host quarterly, and really staying engaged with the work that we're doing. Your feedback is so important to the work that's happening, not only within the U.S. National Water Safety Action Plan, but in using your work as examples to new states and communities that are beginning this work. So we really appreciate the continued support and look forward to continuing to collaborate. Okay, well, with that, I don't see any new questions or comments coming into the chat. I think we'll go ahead and adjourn. Tina and I will stay on right until about 2:30, but thank you again for your time today and for your participation.